What are molecular pathways in pancreatic cancer? Targeted therapy. Imagine unlocking the secrets inside cancer cells to stop them from growing and spreading. That's what molecular pathways in pancreatic cancer targeted therapy aim to do. These pathways are like the communication routes within cells that control their growth, survival, and ability to spread. When these routes go wrong, cancer can develop and become aggressive. Targeted therapy focuses on blocking these specific routes, offering hope for more precise and effective treatment options. One of the most important pathways involves the gene called CRAS. Nearly 90% of pancreatic cancers have mutations in CRAS, which keeps the gene constantly active. This activity sends signals that tell cancer cells to grow, divide, and invade nearby tissues. Because of this, CRAS is a major driver of pancreatic cancer. Developing drugs that directly target CRAS has been challenging, but recent advances have led to inhibitors that work on specific CRAS mutations, like CRAS G12°C. These drugs are still being studied and are suitable for a small group of patients. CRAS also activates other pathways that promote inflammation and help the tumor evade the immune system, making it a key focus for research. Another critical pathway is the pi3°C mTOR pathway. It controls how cells grow and use energy. When this pathway is overactive, it helps cancer cells survive and resist treatments. Mutations or loss of tumor suppressor genes like PTN can turn this pathway on. Drugs that inhibit parts of this pathway, such as mTOR inhibitors, are being tested in clinical trials. These targeted drugs aim to slow down tumor growth and improve patient outcomes. Genetic flaws in DNA repair pathways also play a role in pancreatic cancer. Some tumors have mutations in genes like BRCA1 and BRCA2, which normally help repair damaged DNA. When these genes don't work properly, the cancer cells become more vulnerable to certain treatments. PARP inhibitors are a type of targeted therapy that blocks another repair process, causing cancer cells with these mutations to die. This approach is approved for patients with germline BRCA mutations and has shown promising results. Tumors also need blood vessels to grow, which involves the angiogenesis pathway. Factors like vascular endothelial growth factor stimulate new blood vessel formation. Drugs that block these signals, called antiangiogenic therapies, have been used in other cancers and are being explored for pancreatic cancer. However, resistance can develop, so ongoing research is needed. Other pathways under investigation include the Notch and Hedgehog signaling routes, which help tumors grow and modify their environment. Targeting these pathways is still experimental but offers potential for future treatments. The JAK-STAT pathway, involved in inflammation and immune response, is also being studied as a target, although it's not yet part of standard care. To make the most of targeted therapies, doctors perform molecular testing on tumor samples. This helps identify specific mutations or pathway alterations that can be targeted with drugs. For example, if a patient has a BRCA mutation, they might receive PARP inhibitors or platinum-based chemotherapy. Clinical trials are also exploring new drugs that block CRAS or pi3°C mTOR pathways. Overall, targeted therapy in pancreatic cancer aims to attack the disease at its molecular roots, potentially leading to better outcomes and fewer side effects. But because cancer cells can adapt and find new ways to grow, combination therapies are often needed. It's important to remember that these treatments are part of a broader approach that includes surgery, chemotherapy, and radiation. Always consult with healthcare professionals to determine the best personalized plan, as each patient's situation is unique. Continued research and clinical trials are vital to unlocking more effective targeted options for pancreatic cancer in the future.